So welcome, my name is Laura, and today I'm going to be talking about the importance of statistics in organ donation and transplantation. So, NHS Lung Transplant is a special health authority, and it provides a wide range of services to the NHS. So our responsibilities include optimising the safety and supply of blood products, organs and tissues. So within this we coordinate transplant activity. We have to maintain the transplant waiting list and also the UK Transplant Registry, which is a big database where all the information is stored. We encourage donation of organs, blood and tissue. So within that we manage the organ donor register, which is the big register where people can donate, put their wishes of what they would like to donate after they die. We have to raise the quality, effectiveness and clinical outcome of blood and transplant services and provide support, available support to health services in the UK and other countries. So just looking at waiting list and transplant activity over the last 10 years, so the blue bars here are the number of deceased donors, and the grey bars are the number of transplants that have happened. So as you can see, over the last 10 years there has been an increase in the number of donors and the number of transplants. But the line at the top is the waiting list, and even though there has been a decline over the last 4 or 5 years, there still is a big gap between the waiting list and the number of organs that are available. So kidneys are the most transplanted organ in the UK. There are 24 hospitals that will transplant a kidney, and there was about just over 3,200 kidney transplants that happened last year. And for the other solid organs, there was about 1,600 transplants that happened. And transplantation is very effective. The graft survival rate for a kidney transplant is about 95%, and for the other organs at 1 year it's over 75%, so it's a really good treatment choice. So the department in which I work is Statistics in Clinical Studies, and so what do we do? So we provide a comprehensive statistical service to the UK transplant community. So this includes requests for information, it could be from the media, the Parliament, researchers, even just members of the public. We monitor the organ allocation schemes to check they're being fair and equitable, and also hospital performance. We produce annual reports for the Department of Health and also just for the general public's use. But most of our work is project work, and this is done to provide evidence which drives change, and in turn that improves patient care. So even though most of our work is within the transplantation area, there are a couple of colleagues who do also undertake transfusion medicine and stem cell research, and we are part of the clinical trials unit. So there are several clinical trials running in transfusion medicine and transplantation. We are chaired or directed by Professor Dave Collett, who's well known for his several books on survival analysis. And our department consists of 23 statisticians and 16 clinical trial staff, and I think it's quite rare to find so many statisticians in one place. So now I'm just going to talk about some recent examples of work we've done. So this is a project that one of my colleagues undertook, which looked at the effect of donor smoking on survival of transplantation. So smoking is prevalent in the general population, about 20%. However, 39% of lung donors do have a history of smoking. So even though the lungs are carefully examined before they are transplanted by experienced surgeons, in 2009-2010 there were some media concerns that actually people were dying after receiving these lungs from a smoking donor. So what my colleague did was she took, using data on lungs that were transplanted between 1999 and 2010, she did actually see that, yeah, there was poorer survival if you did actually accept a lung from a smoking donor. However, she then saw that the risk of death waiting for a lung from a non-smoking donor was greater than the risk of death if you accept a lung from a smoking donor. So if I put that in another way, if you're set on the transplant waiting list, your risk of death is higher if you continue to wait for non-smoking lungs to come up, rather than just accepting the smoking lungs that are available. And obviously this is really important research because patients can then make an informed choice, and these results were published in The Lancet. So now moving on to a project that I worked on called the Paediatric Relative Chance of Transplant Tool. So it was raised at a kidney transplant patient representative meeting that there was a significant lack of information on waiting time to kidney transplants, and this can often make it difficult for patients to manage their lives and what's actually happening. So the current median waiting time for a paediatric is just under a year, but obviously who is the average patient? And there can be quite a range. So what we wanted to do was we wanted to look at the factors which affect waiting time for kidney transplants for paediatric patients. So I used data on just over 600 patients who were registered for a kidney between 2006 and 2012. And what we did was we split the data into two data sets. So we kept 1/3 for building our model, and then we reserved a third back for actually testing it to see, well, how good is our model? So we fitted our model and we found 5 factors were associated with an improved chance of transplant, and included within that was ethnicity and age. And then using our validation data set, we wanted to see, well, how good is our model? So what we did was we plotted what our model predicted against actually what actually happened in reality. So what our model predicted was the dotted line, and what actually happened was the straight line. And as you can see, it tracks it very well. So we did actually have quite a predictive model. So we did all this analysis, and well, how do you make this complex analysis accessible to clinicians? So what we did was we came up with this tool, the Paediatric Relative Transplant tool. So it's designed in Excel, and basically the clinician puts in the patient factors over on the left up here, and then once they've put in the patient factors, the graph appears, and it basically shows the proportion of patients of that patient type and how many are likely to be transplanted within certain time periods. So see, you can see here this patient actually has quite good chances, 89% within 1 year. However, if you change the factors slightly, actually this is quite a different picture for another patient. But this is really useful to clinicians because it can be used to guide clinical decisions. And really encouragingly, this is being now widely used throughout the UK. So, just in conclusion, many interesting problems arise in connection with organ donation, transplantation and transfusion medicine. And new developments in the field do lead to new statistical problems. And it's an area of application where statistical input helps to save or improve quality of life, which is quite nice to know, really. It's not, you're actually helping someone, hopefully, somewhere. So positions do come up within our department, and when they do, they're advertised on NHS jobs and also the All-Stat mailing list.